Right Honourable Speaker. Right Honourable Speaker, 3 weeks ago, the leader of opposition raised a matter concerning medical interns. The same was raised last Thursday, and I'm glad the minister is here. He had committed that today he will present a policy by government on the interventions that are undertaken to make sure that our medical interns are catered for. I am glad 2 days ago, I saw him in Mbarara General Referral Hospital, where he found 2 medical interns covering the ICU. May it please you to ask the minister to give us the developments from cabinet on the placement of medical interns. Thank you.
Honourable Minister, do you have any update for the House?
Thank you very much, Right Honourable Speaker and the Honourable Member for raising the issue. Internship, in this sense, means a medical student pursuing a degree in medicine or dental surgery or even pharmacists or nursing completes the university education, graduates, and then before you are issued a practicing license, you undergo apprenticeship or internship for 1 year under supervision. And it's a practice in the medical profession. So a policy, and the government has been facilitating interns with a modest allowance to enable the interns survive as they do internship, usually done for 1 year. A policy was passed to review the issue of internship, and the cabinet made the following decision. There is a policy which was sponsored by the Ministry of Education and Sports on health training, and it was passed as follows: that internship be considered as part of training, and in that respect, that if you have been government sponsored, government continues to sponsor you when you are doing internship. And if you have been on private sponsorship, then you continue on private sponsorship during internship. There have been mixed reactions, and I know this matter was raised by the leader of the opposition. And just hold on. Just hold on, I will allow you, but let me first complete this sentence. And the Right Honourable Prime Minister and Her Excellency the Vice President made a commitment, and indeed we are relooking at that policy measure. I am drafting a cabinet paper to take back to cabinet so that we look at that decision again. And I think the concerns are genuine, because internship, much as you are under training, but you are also providing a service. So I want to request Parliament. To be patient, because this is a matter which was canvassed in the cabinet. I cannot singularly reverse the position. So you give me time at the earliest. Once cabinet has put me on the agenda, I will present a paper, and then once the decision is taken, I will come back and brief Parliament on the matter.
Thank you. I will allow you on
Excuse me, Minister.
Honourable Minister, I will allow you on one if you want.
I also want you to clarify on the issue of the...
Honourable Minister, whom did you allow? I just
He
want
allowed
to
me.
know.
He allowed me. I'm the one who raised it the
Please,
other time.
Honourable, please, that's not how we do. Whom did you allow?
Okay.
No, it's not a
Actually,
matter of grabbing the
I
microphone.
beg that you allow we allow the two, because I am trained to be very humble to ladies.
Thank you so much.
Maybe
Thank you.
And men are known for grabbing from women.
as long as they are brief.
Thank you, Right Honourable Speaker, and thank you, Honourable Minister. Honourable Minister, your response, where you stated that there has been a cabinet decision that interns be treated like interns be treated like they are on a training. truly they are on a training. But Right Honourable Speaker, the clarification I'm seeking from the Minister is that sounds like there's a policy shift or change, if I may call it. And I think it would be prudent that you, the Minister, comes with that policy shift or change, and we also debate it perhaps. That is the clarification I'm seeking. Is there a policy shift, or it is just a cabinet decision? But I think it tantamounts to a policy shift.
Thank you so much. Thank you, Honorable Minister. Honorable Minister, I want to bring it to your attention that in the 2024-25 cohort and 2025-2026 cohort, there are some interns who are not paid. These are the clinical officers who are doing the internship. Because this is not the same as their salary, this is just an allowance, but they are around 300. And secondly, the senior house officers. You know, we have a challenge that our doctor to patient ratio is 1 to 25,000, which is far big number compared to the international number of 1 to 1,000 of WHO Health Organization. I need your clarification on that. Thank you.
Honourable Minister.
I think most of these issues, Right Honourable Speaker, will be answered when I bring a comprehensive statement. I have just said that I am preparing a paper for Cabinet to look at that policy decision. And maybe I can add that what is causing this is that initially we had Makerere Medical School being the only university training doctors. But because of the policy on liberalizing tertiary education, tertiary and university education, we now have many universities training doctors, both public and private, and therefore the numbers have grown. So we are discussing this with the Ministry of Education to even look at how we guide the universities on the numbers, how many train for the medical profession, and I will capture all these when I bring the paper. Yes, there are issues of payments, and there are lots of reforms we are proposing within the ministry, and that's why you see me working day and night, even visiting hospitals at the night to check the reality on the ground. And I will be bringing papers here seeking support of Parliament, because like one of the challenges we have in the health sector is the staffing. When I went to Mbarara Regional Referral Hospital, the director told me the staffing level is at 26% of the hospital. So there are all those challenges, and I want your collective support as Parliament that we work together and see how to strengthen the health sector.
Thank you, Honourable Minister. Honourable Kuguzizibwe Lawrence. Honourable Kuguzizibwe Lawrence.
I would have allowed, but the Speaker is pressured by time.
Honourable Kuguzizibwe Lawrence.
But I will